We're going to show you the customized application of a radial gutter cast.
This is one of the more difficult short arm casts that you'll do. Anytime you incorporate digits, either on the radial side or the ulnar side, it becomes a little complicated. It's a little more technical.
I'd like to take things all the way back to the basics. So simple definition, radial gutter, ulnar gutter. If you're on the radial side, thumb side, it's a radial gutter cast. It's a gutter because it's incorporating some of the digits. Same thing on the ulnar gutter cast. It's going to be on the ulnar side, but the gutter part incorporates the digits.
For radial gutters and ulnar gutters, we always set it up as if we're doing a short arm cast. So we're gonna pat it. And for radial gutters, the injury is gonna be in the fingers or the metacarpals. So you don't need to go as high proximally on the forearm. Usually mid forearm is adequate for about anything that you're treating for this cast.
This is kind of a two-step process we're talking about. You'll see how we fold the stockinette back here. These are just some of the tricks we've learned to make the application a little bit easier. Sometimes you get perplexed when you look down and you say, how am I going to put 2 or 3 pieces of stockinette on this and actually make it work?
We get a lot of great feedback on these casts, especially if they've transitioned from a splint to a cast. They always say the cast is much more comfortable.
So you can watch the technique here of the application of the third strip of stockinette that we put on here, because we also put one on the thumb.
If you cut it like we did there on the sides, kind of gives you wings. So as you pull it through the digits, it gives you something that you can anchor the stockinette to, so it doesn't end up pulling back up. On a cast, typically they're going to be in it for 2 weeks or longer, so it's good practice to put padding between the digits.
It helps with the maceration and reduces some of the odor. Anytime you incorporate toes or fingers in the cast, it's always good to use some type of gauze or something to absorb the moisture that's created.
So for this cast where we're casting the second and third digits, we want to avoid any excess bulk between the third and fourth fingers. So we're going to show you how to reinforce it here so you don't have to use as much cast material, and it makes a much better experience so the patient can keep their range of motion in their exposed fingers and not rub on the fiberglass.
Early on when we started doing ulnar gutter and radial gutter cast, we noticed that if we didn't reinforce these, oftentimes they would break, especially in a teenage adolescent person. They would break right down on the volar aspect or sometimes even on the dorsal aspect of where the outrigger comes out.
I'm taking the 2-inch splint material and cutting about a 1/2 inch off of it. We're going to put it on the dorsal side of the patient. If you have a patient that you have any concerns about, like a younger kid or somebody that's more active, you can actually place one on the dorsal and volar side to give it a little more strength. We found that just one strip will usually be enough strength.
We have used 2 many times, but when you do that, it often makes your cast a lot more bulky. Patients really appreciate when you can reduce bulk on these.
Folding the stockinette back, we doubled it up there. That gives you a little padding for the splint material there so it doesn't rub on anything or it's not exposed.
Also helps hold it in place as you fold it back and keep those ends exactly in the certain place that you want it to be in as you apply your cast material.
For the stockinette on the distal end of the digits, you can twist the stockinette a few times, and that will eliminate anything getting down inside the cast. Sometimes we will cast patients that have pins in their fingers, and they appreciate the twist because it will keep debris and dirt from getting down inside of there and keep the pin sites clean. Be sure the patient doesn't deviate the wrist ulnarly. They'll get relaxed and just kind of let it drop down, so you want to keep reminding them. You can always increase the positioning after you're finished, but you want them as close to the correct position when you start to cast.
Use that towel. A lot of patients get nervous that that color is going to drip off the cast material and land on their clothing. Don't submerge it completely in the water and drown it. Just lightly get wet.
Make sure you use cold water as well. This takes a little bit longer to wrap, so using cold water will give you more time. For this one, I'm starting distally, working my way proximally. Sometimes it's a lot easier to start at the digits and work your way back. Here we're weaving the cast through there. You don't have to cut it because you're incorporating the digits. The MCP joints is where you'll have the weakest points. So this is a way that you can get it stronger at those points.
One little pearl that you'll want to pay attention to: when he put the cast material in the pan, that he didn't leave it in very long and he didn't squeeze it very hard. Oftentimes I've even gone as far as to just get my hands wet and hold the material in my hand so that it doesn't dry. The last thing you want is the end of the cast material to start to harden up on you. It makes it impossible to go through the web spaces and around the fingers. So it does take a little bit more time. If you have a roll that's going to set up rather quickly, you will be in a little bit of trouble, so you have to wrap fast.
So after you get your fiberglass on there, you want to keep in mind the positioning of the patient. You want the MCP joints as close to 90 degrees as you can. Wrist is in neutral or slight extension. We may emphasize on the fiberglass strip, the reinforcing strip that we use. If you do not have access to that, you can usually use another roll of fiberglass and roll it out, maybe 3 to 4, maybe even 5 layers thick, and then cut it off and measure it to whatever you need and trim it, and that will suffice for the reinforcing strip also. you happen to get your cast material down into the web space between the fingers, you can use scissors or the cast saw. The scissors are much easier. You always want your patient to be comfortable and have as much range of motion in the digits that are left out of the cast. So cutting out any excess bulk there makes it much easier for the patient. It's really important to get a good mold on this cast. So through the palm, through the fingers, you're going to constantly want to keep molding it so it fits appropriately.
Because it is a little bit shorter than a normal short arm cast, you do want to have a good appropriate mold in the volar part and also in the distal end of that cast so that it doesn't roll from side to side. Also look on the distal end of the cast here where the second and third digits are incorporated in the cast. He has it nice and flattened out so that those two fingers are not squished or crunched together. You want to make sure that there's adequate space on those digits.
It's important to make sure you have them in the correct position right when you first start wrapping your cast material, because there's been a few times where I've found that the patient was extended a little bit far. Then when you go to flex them into that position, a lot of times you'll get a crease right there on the volar aspect, and it's always going to dig in on that side. So make sure you get them in the correct position before you start wrapping your fiberglass material.
You'll notice here that our focus is on the second and third ray, but we have to keep in mind that the fourth and fifth need to be exposed so that they're not getting rubbed on any of the other portions of the cast.
And a technique that we're showing you here that we've found that works very well is kind of eliminating that sandpaper that's going to rub on their ring finger there. Sandpaper, of course, being the fiberglass, it gets pretty rough and pretty hard. So we've found some adhesive tape that we can cut a little crescent shape out or a half moon shape out on that first piece that we put in. That makes it slide right up into that web space. It adheres perfectly to the fiberglass, and then the next piece you want to measure to the appropriate length to come all the way out to the end of the third digit that's wrapped in the fiberglass. That gives it a lot more padding, so you're eliminating that abrasion to the ring finger.
On a radial gutter casts, there's going to be times where you may be asked to include the second, third, and fourth. And like Clint mentioned earlier in the video, if you're asked to do a radial gutter cast to include the 2, 3, and 4, you know it's on the radial side of the wrist. That's why it's called a radial gutter cast. We know we put that fiberglass reinforcement in there. We don't want to cut through that because it can increase the heat of the cast saw and make it harder to take off.
This cast removal can be a little tricky for a novice cast technician. Oftentimes they'll walk in and look at this and be a little perplexed on where to start. As we indicated earlier, always do the dorsal and volar side. I have seen people try to approach it down the radial and ulnar side, and you just create a lot of extra work for yourself and a lot of discomfort for the patient. So be mindful and use this technique. You can always pull the digits out of the radial gutter portion of this cast. It's a lot better than trying to do a clamshell in the opposite direction.
Always be aware of the patient's injury when you're taking casts off as well. We've worked with surgeons that are pinning fractures back together. So as you're taking the portion of the cast off where there may be pins, you always want to be cautious so you're not just ripping it off. You're doing it real slow so you're not catching on the pins.
Or the incision. Oftentimes they may even have an incision with a closed reduction, and be mindful when you're working your scissors around the incision.